I'm Lynn Yackel, Director of the Institute for Women's Health and Leadership of Drexel University College of Medicine. The year 2013 marked the 20th anniversary of the Institute, and we celebrated with a two-day conference focused on women's health and women's leadership. Highlights of those 2 days are featured in this video. Through the years, the Institute has been a connector, connecting people, ideas, and resources. Connecting was evident during these 2 days, and that's what made them very special.
Absolutely, I learned a lot.
People don't understand that women have been neglected in terms of science for so long.
The subject was change, and leaders embrace change.
It's wonderful. We are getting a lot of new information.
This conference serves as a lightning rod. It's an excellent educational conference.
It's invigorating to see how women walk out of those events energized and enlightened by the new knowledge that they've gained.
I've certainly enjoyed the conference because it highlights the problem, and that's the first step towards solution.
I think hearing about the past, the present, and the future really allowed me to formulate my thoughts on how this has all impacted me in my career.
It's fascinating. I think it's really great that there are these amazing women working on these initiatives.
Proud, very proud.
What people were talking about on September 26th and 27th in 2013 was the 20th anniversary celebration of the Institute for Women's Health and Leadership of Drexel University College of Medicine. They celebrated in the way they know best, with a special day devoted to women's health and another to women's leadership. The agenda, featuring some of the best minds in both health and leadership, kept the focus clearly on the Institute's three-part purpose. There were reflections on barriers overcome.
Who better than Dr. Pinn to tell us today the story of evolution of research in women's health. So without further ado, Dr. Pinn.
When I started medical school, there is my class at the University of Virginia, and among all those men, you can see there I am. All of my classmates were men, and I was the only person of color. And one of my classmates came to me a couple of weeks into the anatomy course. I remember that we were standing over the cadavers, and he came up to me and he said, "Vivian, you have no business being here." He said, "I read ahead," you know, there's always somebody smart, read ahead. "I read ahead in my anatomy book, and I saw that women have smaller brains than men. So you're just taking up a place, because you'll never finish medical school, you're just taking up a place that a man could have." There's the class graduation picture. There I am. He's not there. He flunked out. So,
And even though this country is thought to be one of pluralism, there was a great deal of cultural dissent that was going on during the 90s. There was a lot of turmoil on campuses in the discussions about free speech, protected speech, political correctness, along with issues of gender and diversity.
And remember that this is about not the dissemination of women's health research, but the dissemination of efforts to educate students about the research.
At the time that we were so active in the 90s, women's health research was one of the leading fields of new information. But there have been multiple fields that have had enormous breakthroughs. They too have to be included in the curriculum.
You know, history it's not a dead thing, it's not part of the past. It's really about change over time and momentum and moving things forward. It's about the present and the future. At a time when the world didn't want women to leave the domestic sphere that they were in, they were starting to get out of that sphere and force their way into a place of equality.
There was recognition of two who did so much.
I cannot imagine a more worthy recipient of this Lifetime Inspiration Award at Drexel University. He will be a very tough act to follow for those who want to follow in his footsteps, but he has set the bar very high.
I have spent 15 years as a volunteer, and it has been so wonderful to see what has happened. I believe that the Institute for Women's Health and Leadership has flourished in the past 20 years and is a tribute to the many graduates of Women's Medical School from the year 1850. They passed the baton to Jean Hamilton, Bonnie Faulkner, Glenda Donahue, and Lynn Yackel, who have carried this sacred legacy.
Dr. Bernice Sandler is a senior scholar at the Women's Research and Education Institute in Washington. But more simply, she is a pioneer, dedicated enough to devote her entire life to educational equity for women, creating positive change for girls and women for 4 decades, and strategic enough to see that her principles became a driving force behind the enactment of Title IX. In fact, the New York Times called her the godmother of that game-changing legislation.
But I remember my youth, we had big discussions. Could you ever have a platonic relationship between a man and a woman? And we would debate that and discuss that because it seemed so unreal. This is, I think, one of the most important outcomes of the women's movement and of Title IX, is that it is teaching and continues to teach boys and girls and men and women how to respect each other and to be friends.
There were reminders of current challenges.
Now, women predominate in depression, in anxiety disorders, as I said, eating disorders, and they also predominate in neurologic disorders like multiple sclerosis, and actually there's a 2 times greater risk in women for Alzheimer's, and it's not because women live longer. So really some of the same factors producing independently cardiovascular problems were also being looked at in animal models and in humans as problems with depression.
Women of reproductive years are clearly at increased risk for depressive episodes. In fact, 60% of first episodes of major depression among women happen in the postpartum period.
Remember that the #1 cause of death in our diabetic patients is cardiovascular disease. And we still do see disparities in treatment for the women, where women receive less treatment for those modifiable risk factors that really elevate their risk for cardiovascular disease.
We do have curricular reinforcement of specific topics in the 3rd year, which include topics such as intimate partner violence, as well as our pathway. And along the 4 years, we have opportunities for students to participate in community engagement activities, our Women's Health Scholars Track, as well as additional research opportunities.
We're talking about comprehensive delivery of health care for women. I think having a systems approach here is what we're looking for, and that will include the patient, it will include the provider, and it will include the important and necessary support services and how these can interact and work together.
So a lot of the kids that are around these days, anything that they read on the internet must be true. So it's really, it's really hard for them to separate out good information from bad information.
In 2010, there's about 40 million Americans over 65. In 2020, it'll be 55 million. In 2050, it'll be 80 million. So what I'm going to be doing, what I'm teaching my residents and my students to be doing, is that we are going to be caring for older Americans for a preponderance of our practice, and there's simply not enough of us to do that.
And the future, both its problems and its promise, received plenty of conference attention.
But when I think about the path ahead, I think we still have to continue stressing the importance of women in science and in healthcare, and increasing career opportunities for sustained leadership. We don't want to just see women promoted and then they don't get to stay there and make room for others to come behind them.
There are so many problems around the world related to women's empowerment that it's always a bit of a struggle to know, where do you focus? I guess I look for issues that I think people don't know enough about. So I'm kind of in the lighting business. So I shine my spotlight on something, and then if people don't know anything about it, if I illuminate it, then it can have a real impact. It can make them, make my readers spill their coffee in the morning. In a sense, that's what I want to do, because that is a prelude to making a difference.
Today is the Leadership Forum, and it was started off for us this morning with an absolutely wonderful lecture, the Marion Spencer Fay Award Lecture, given by Dr. Nancy Andrews, who is Dean of the Medical School at Duke College of Medicine.
Women should push for and accept seats at the table. I believe that this is very important for getting it right, for building the new culture that we want. Diverse groups, including women, think about problems more creatively and suggest more innovative ways to address them. Thank you very much.
This is a room full of leaders. I'm absolutely delighted with the people who have signed up to be here today, including our President, John Fry.
So one of the most critical tasks we can undertake in higher education and in society in general is to make sure that women are fairly represented in leadership positions. But the success of our vital commitment to shared leadership ultimately hinges on the day-to-day approach that we take as organizations and as individuals. Each of us has our own leadership style that has served us well, otherwise we wouldn't be together in this room today. But we need to be vigilant that we don't mistake our style for the best or the only style. We must constantly examine ourselves and the assumptions we make about those we lead and those who lead us.
My mother was always the one that praised my achievements. My father was the one that said, what more, what else, what's next? And it was a nice compliment.
Sports represents the American ideal of fairness. It's played out on the field. Sports can mean nothing, and it can mean everything. It's become the battlefield of gender equity.
So inclusive leadership has a very specific term in the literature, because I do management research, right? So inclusive leadership really means working with others and doing things with people and not to them.
You got to put the subject on the table. You got to put front and center, and you got to talk about it. You got to be very forgiving to people and try to really get to the root of why they're thinking that way, and then turn them around.
All of this conducted in collaboration with Catalyst, concentrating on the future of shared leadership among women and men, and resulting in an array of professional commitments.
Women are making tremendous strides, but I think the greatest impact is going to be had when women and men work together to bring about change in this area.
If you start with leadership, and then you can drive education and research. So we understand that diversity, gender diversity, and sex differences are important in how we care for our patients, and a lot of the research is actually done here at Drexel.
Looking at women's health, we've only begun to touch the surface of looking at conditions that had not been studied before, and to make sure we're providing a sex-appropriate, personalized health care for women.
Discrepancy between men and women, whether it's medical and anatomic, or whether it's psychologic, or whether it's leadership, will dissolve because there are definitely differences and they're being proved, but the gifts come to the table from all different places, and I think when we can stop making fun of the other gender or being at all prejudiced and just rather being receptive to the individuals, I think it'll even get better.
It's often challenging to reach minority ethnicities in prevention as well as promotion of healthcare.
And so the things that I've learned from these great women, I can provide to future generations after me.
This is about now moving forward to get more and more men involved in this and setting an agenda that we can keep the momentum going.
The 2 days in September, like the 20 years that went before, recognized the value of change and called for a continuing commitment to the challenge of making a difference through women's health and women's leadership.
I guess what really keeps me going is that overall, I've really seen an incredible tide of progress over any kind of time period, and some enormously inspiring people out in the field working against Sisyphean odds and truly bringing about change. So I think we are in a better place now than we were 20 years ago, and I have a lot of confidence that 20 years from now we'll be in a better place yet.
Hopefully in my lifetime, I can say, you know what, we're finally equal.